in-depth knowledge of the local population?
Well, I think so. I think I've got some knowledge of the population. I work in contact with them for all the time, yes.
And in your submission, you set out the development of your service and the surprisingly high uptake of that service. Could you recap for the Commission and others present, please, what you say about who is using those facilities and why? And can I give you a reminder with the voice straight away?
I worked very hard at Ealing over all this time, and I always see myself as my main duty being to provide the best possible service to the local community. And over the years, my work increased constantly, and eventually I was driven to count how many patients I actually saw, why my service was so big. And essentially, I was getting 50 new referrals every week, and which is a large number in all terms. And I collected, nobody believed it, so I collected the referral letters from GPs, and they presented them to the chief executive, and they tried to sort of back up the service accordingly. And there was always reluctance to do that because it was costly and the usual excuses. But it was a large service, and I also had a very open service to the local GPs. We had a lot of communication by the phone and then eventually by email. And my secretary was also always very busy. And that, in fact, was the whole impression was that nobody knew where the patients came from. And I wasn't the only one of the clinicians at Ealing who had that experience. And were at meetings in the hospital, we were told that that couldn't be possible because the population of that we served was very small, was 200,000 or around there. And eventually, I mean, most of my colleagues that worked Ealing agreed that the numbers didn't tally with the population that we seem to have. So that's where I started looking at different reasons why this would be the case.
Can you pause there? Can you help us with when you undertook your research? Just roughly.
Yeah, about 3 years ago, 3 or 4 years ago.
Thank you. Please do it.
So we all agree that the reason is that the population that we serve is probably much, much larger than what is generally assumed. And looking at the type of patients that we look after, I look after, most of them came from South Hall. So one of the work I did is very simple. I just went to some travel agents in South Hall and asked what was the communication between South Hall and Punjab. Punjab is the largest minority group of patients that we look after at Ealing. And I was astounded by when I found out how many flights there are between Heathrow and South Hall, and they were all full.
So pause there a moment. Am I correct that what you're saying is that one, there is a much larger resident population using your service in South Hall than is measured?
Correct.
And two, there is also a large peripatetic population, again unmeasured, that comes and goes. Have I got that right?
Correct. And what happens in the clinics is very common that patients come and say, well, I'm just about to take 2 months holidays. And where you go? Well, I'm going to visit my family. That is extremely common.
So as far as you are aware, and I don't know if you can help with this or not, do you know whether those sections of population have been included in any of the figures that, on which this exercise is based?
No, I don't know that. It's impossible. I wouldn't have the tools to do that.
Are you able to say, you've estimated or guesstimated, I should say, 400 to 500,000 in terms of the population? Is that including the peripatetic population or excluding it?
I included those, I imagine. But talking to my colleagues of the specialty, very few nationally have got such large number of new referrals every week. It's very rare. So, if you ask me, where do these people come from?
So, your clinics deal with a far larger population than on paper you would imagine.
Correct, what we expect.
And you say in your submission, and you say this quite, you say it is madness to downgrade Ealing Hospital. Can you help us with why it is madness to do that?
Well, my experience has always been that Ealing is the main population that we look after is in South Hall. And South Hall is a large urban area of a population which requires healthcare services. They are poor, they are in poor health state. We know there's a much higher than average level of cardiovascular disease and of certain infectious diseases and of metabolic syndrome, and they also it's a buzzing area that is very active commercially and productively, and on the educational front is quite buzzing, and I'm sure they contribute largely to the local economy, and Ealing is their local hospital.
So if we take it stage by stage, if the emergency service at Ealing is downgraded to an urgent care centre, what's the impact on that sector of the population?
Yeah, it is. I cannot say, I'm not a healthcare economist, but I can imagine, we know already that there are great difficulties because other sectors of health have been downgraded. And the communications to and from the hospital are not very good transversely. They are good radially, but not very good transversely. And the other hospitals available are transversely away, are West Middlesex, Northwood Park. And it takes a long time to go to those hospitals. I know that because I have meetings there, I drive there, buses are hopeless, and I am sure that it's going to have an impact. In fact, a number of my patients have been transferred because half of my services have been decommissioned, and 500 of my cancer patients have been decommissioned, and there have been huge difficulties.
Pause there for a moment, I'm going to come back to that in a second. In terms of inpatient beds, if those are reduced at Ealing, again, same question, what is the impact?
It's very difficult to say. We know that in my specialty we ran for a while a see and transfer service from the casualty department.
Sorry, could you say that again?
See and transfer from casualty, and that has been reversed now because the other hospitals couldn't cope. So we are at the moment seeing the patients again at Ealing Hospital. So the provisions available at the moment are not sufficient. That may change in the future, but at the moment that is the situation. Now the long-term impact, I haven't got any scientific data on that. I know that a lot of patients find it much more difficult to access the other hospitals from South Hall than they did and they would do in future if Ealing is not there.
Is this something that patients have been saying to you directly?
Yes, many times. Not only that, I have been accused of seeing patients outside the rules because they couldn't access the other hospitals. And that has led to a disciplinary action on me because I saw patients that I shouldn't have seen because the service is decommissioned theoretically.
And thinking about it from a clinical rather than a personal, for individual convenience perspective, what do you say the clinical effects of patients having to go for treatment to those other places will be?
I personally think that long term we are going to see a decrease in the standard of healthcare in South Hall, but that we are not going to see that immediately, because it takes a number of years to see the final healthcare outcome in conditions like cancer services, for instance.
Now, you mentioned that half your service was being or had been decommissioned.
Correct.
Can you help us with whether that is part of the Shaping a Healthier Future programme or outside of it? If you know.
You know, I don't. What I do know is that there was great pressure to do so, and as part of a number of reviews, there were studies done about, I don't know how correct they were, on the provision of cancer services, and the decision by the commissioners was to decommission all urology cancer services at Ealing. And that was half of my patient load for another colleague, but in my patient load that meant that 500 patients who were being seen or followed up for cancer were told that they had to go to another hospital.
And do you know which hospital that was?
They were sent a list of hospitals and were told that they can go to any of them, but not to Ealing.
And do you have a view about the impact that has had on those individuals?
Yes, of course. I was very strongly about it, to the extent that I felt that my duties as a doctor were more important than that, and a number of patients that could not go to the hospital, as they were told, came to see me, and I did see them. And as a result of that, I was sanctioned.
Now, do you also have a view about the proposed use of out-of-hospital and primary care services to reduce acute beds and acute facilities?
Yes, I do. I think that medicine and society is changing all the time and fast, and technology changes. And I think that the provision of healthcare services will change. And I think that's very important and should continue changing. How much of those services go to the community and which ones, I'm not sure, but I think that we should be aware of costs, and as long as quality is maintained, I'm very supportive of transferring services elsewhere.
Are you able to give us a view or comment on the extent to which you think use of primary care and hospital services will allow acute services to be reduced?
No, it's only empirical, really. I think that I'm not sure. I'm not sure. I mean, it will be 10 or 20% less, perhaps. I'm not sure.
And finally, I just want to ask you this. The Shaping a Healthier Future programme is predicated on the reduction from 9 major hospitals to 5 major hospitals. Just from your experience as a clinician, do you have any comment about whether you think that is an appropriate or safe way to proceed?
Well, I think that in my experience, from what I said, is obviously not a good move. But I do think that health services will change. But I think that they should be changed according to the needs of the population, rather than to a theoretical appraisal which doesn't follow the needs, as I just said. And the local population at the moment is exploding, is growing. And I personally think that geographically, Ealing Hospital is the one that is placed in the most accessible position for that population. And it is amazing. It is on a main artery, it is on a main radial artery. We are going to have a major new public transport service which is about to be built in Hanwell through Crossrail.
So this is Crossrail.
Crossrail. And we are walking distance from Hanwell Station to Crossrail. And this is a major public service which I can't believe how in the middle of those changes and progress, we're actually going to close, or planning to close or downgrade such an important public service.
Thank you. I have no more questions, but if you wait a minute.